For communications here at Mount Sinai, South Nassau. I want to thank everyone for coming. I'm just going to do some quick introductions. Dr. Aaron Glad is the chair of our Department of Medicine and chief of infectious diseases here at Mount Sinai, South Nassau. He's also a national spokesman for the Infectious Disease Society of America. Dr. Glad, say hello so they know who you are. Dr. Rob Sharma is our Chief Medical Officer. He's also the Executive Vice President of Clinical and Professional Affairs. And he's also trained as an emergency department physician and has run a number of emergency departments in his day. So he'll bring that perspective to the briefing. And Dana Sanneman is our Executive Director of Public Affairs and the Director of the Truth in Medicine poll. Dana's going to take us through the poll results real quickly. Dr. Glatt will talk about the current situation with the coronavirus and what we might expect here. And Dr. Sharma is going to talk to you about the preparations we have made here at Mount Sinai, South Nassau, and the procedures that we follow, both for staff and patients, to make sure that we keep everyone safe. This is actually our 11th Truth in Medicine poll. The purpose of the poll is very simple. It is to gauge public attitudes about important public health topics and then provide public education about those topics. As I mentioned, this is our 11th Truth in Medicine poll. We want to be sure to thank Beth Page, which is our sponsor and underwrites the cost of the poll. Just by way of information, the poll is conducted by an independent national polling firm that we hired to do the poll, LJR Custom Strategies. So I want to introduce Dana Sanneman.
Thank you. So this poll was conducted from February 5th through February 9th. It polled 600 metro area residents, so New York City and Long Island, between February 5th and 9th. The poll found that only 9% of residents heard nothing or not much about coronavirus. So 44% heard a lot and 47% some, but only 9% had not heard anything. When asked to rate their level of concern about the coronavirus outbreak, 34% had a high level of concern, 28% had a high level. When asked how concerned people were about coronavirus and the outbreak impacting their family, 54% had a very high or high level of concern, and 32% very high. When asked about the flu impacting their family, so a lot of the poll compared coronavirus and the flu, 51% were highly concerned about the flu hitting their family. And residents view the flu as a more serious threat to the nation than coronavirus, with 44% saying the flu is the biggest risk to the U.S. population and 21% saying the coronavirus was the biggest. Respondents were fairly confident that the U.S. government and state governments were adequately prepared to deal with a potentially large-scale outbreak of coronavirus in the United States, with 50% of metro area residents saying they're confident government officials are ready to protect them. 36%, however, said they felt the government was not prepared. Residents are highly concerned about the coronavirus outbreak, and many responded that they're considering changing their habits to protect themselves. 72% strongly agreed that visitors should be screened when entering hospitals or public places. And then we asked some more specific questions about daily activities such as travel. 72% are less likely to travel overseas. 48% are less likely to take mass transit. 46% are less likely to attend large gatherings. When asked, and then when we were looking at comparisons, how many people do you think died from the flu this year in the United States? 48%, so almost half of the respondents, put the number at or below 1,000. Meanwhile, the CDC estimates that between 16,000 and 30,000 people have died of the flu this season. some positive in our poll. 75% said they had received the flu vaccine this flu season, so since September of 2019. And does the coronavirus outbreak make you more or less likely to get the flu shot? So 75% had already received the flu shot. Of the remaining 25%, only 3% said they were more likely to be vaccinated. And slightly more than half, so 55% said if a coronavirus vaccine was available, they would receive it. 45%, however, though, are either not sure or said no. So I'd like to bring up Dr. Glatt to discuss a little bit more about coronavirus and the specifics.
Thank you, Dana. It's a pleasure to be here. Unfortunately, we have a very serious epidemic right now going on in the United States, and it's not COVID-19. It is influenza. And I have a slide here to just give you, at least as of today, the current numbers that we have seen both this year and in previous years from some very serious world viruses. If you look at COVID-19 right now, which is this novel coronavirus that started in Wuhan in China in December, there have now been over 80,000 cases. That number is probably an underrepresentation of the total number of cases because they didn't include necessarily very mildly symptomatic cases, and they didn't include necessarily looking for all of the cases that were in associated people to the cases that they did have. So that number probably underrepresents the total world cases, and you can see that the death total tragically is almost 3,000 people already, 2,770 as of today. And that translates roughly on these numbers into about a 2 to 2.5% mortality. I think the bright side of that is that probably is high, and that there are certainly selected populations, such as children, that seem to be doing relatively well. There has not been a single reported death of a child under the age of 10, and there are hundreds, if not thousands, of such cases already that have occurred, and yet, thank God, we have not seen any deaths in children under 10, and even in the older children, adolescents, and younger adults, the unfortunate outcome of death has been very low. Where we have seen a lot of the deaths has been especially in elderly and those that have underlying respiratory or cardiac conditions, and therefore it's not surprising that they're going to do more poorly with the disease that affects the lungs. And there, the mortality rates have been anywhere between 5 and even 15% in the highest risk patients. That's what's going on right now as of today. What will happen tomorrow, it's very difficult to predict. What we have to do is be as prepared as possible, and the hospital was certainly preparing. You'll hear a little bit more about what's going to happen if somebody comes into the emergency room, but we're certainly doing a tremendous amount of screening by history to try and identify and isolate as soon as possible anybody that could possibly have COVID-19. However, right now in the United States this year, during the same period of time, maybe a month longer, when you look at influenza in the United States, there have been over 30 million cases, and unfortunately, tragically, at least 16,000 deaths. That number is probably underreporting, and there may be anywhere from 25 to 30,000 deaths this year in the last 3 or 4 months alone in the United States as opposed to worldwide. And that tragically includes 105 children who have died of influenza in the last 3 or 4 months in the United States, with our access to very high-tech, excellent health care all over the country. So this is something that is vaccine preventable to a certain extent. The flu vaccine is a good vaccine. The data just released last week from the CDC suggests that it's 55% effective in children. That means if 2 children get it, the vaccine, they're 50% less likely that they'll get illness than 2 other children that don't get it. So you may have only 1 of 2 versus 2 of 2 children exposed to influenza getting it. So it's a very effective, safe, and good vaccine. And unfortunately, the data from the last decade in our looking at this show that the children, unfortunately, that die of influenza, the vast majority, in some studies up to 80% of them were not vaccinated. So this is still something that we can do something about today. It's not too late to get vaccinated today. To put the seriousness or severity of the new novel coronavirus, COVID-19, in perspective with two other similar novel coronaviruses. The regular coronaviruses are the cause of the common cold. It is these three novel coronaviruses, first SARS, which was identified in 2002, that, thank God, only had 8,000 cases, of which 774, the outcome was death. So that's about a 10% mortality. If you look at MERS, we, thank God, have not seen SARS since 2004. MERS emerged in Saudi Arabia. It's the Middle Eastern Respiratory Syndrome, and in neighboring countries. So that there's only been about 2,500 cases in the world since then, but it still is around in low numbers. And that has an even higher mortality rate, maybe even approaching 1 in 3 patients who get MERS dying. So this is very, very significant to see the potential for these novel coronaviruses. And you look at the mortality for influenza, it's about 0.1%. So this is just to put things in perspective, the seriousness of these, but it also, besides the severity, you need to take into account the commonness, how frequently it's occurring, and by several orders of magnitude, influenza is much more common than COVID-19. And in our survey, people are worried about coronaviruses, the novel coronavirus, as they should be, but right now, there's nothing that a person should be doing to prevent themselves from getting coronavirus at the present time, other than possibly restricting where they're traveling. But the concern about being prepared is really more for public health officials, hospitals, to make sure that we are as fully prepared as possible to handle cases that come into us. And you'll hear a little bit more about that from Dr. Sharma in a moment. After his presentation, we'll be happy to take any questions that you may have about coronaviruses themselves and the potential for this becoming a major problem in the United States. Dr. Sharma.
So are we ready? It's a good question. And you saw that our respondents said that about 50% said that they felt that the governments were ready. And I'll say that coronavirus is part of what we call emerging infectious diseases. It's probably the greatest threat to humanity in terms of where we can see harm. And we've been preparing for this for decades. So this one is novel this year. We had Ebola a few years ago. We had H1N1 a few years before that. And if you remember, we even had domestic anthrax scares back in the early 2000s. So we've been preparing for these types of events for some time. And we do tabletop exercises to review policies, procedures, make sure all of our staff is trained. And I'll go over a couple of things. So first, just in terms of preparation, the CDC is working on a vaccine, but that's 12 to 18 months away. So it's unlikely that the vaccine will be available for this year. And they are suggesting that this coronavirus, like H1N1, may become part of the regular flu season in terms of people getting sick with this going forward in the future. So vaccine development is extremely important. And Dr. Glatt may want to talk about that a little bit further on. If a patient presents to the emergency department, and this is any emergency department, but certainly at Mount Sinai South Nassau, we are prepared to receive such patients. In fact, we've already screened for 2 patients for coronavirus who had high travel risk, including Italy and South Korea, 2 of the top 5 nations for coronavirus pandemic right now. And what we do is we take the patient, they give us their travel history, they are put into respiratory isolation, a mask is put on the patient, the staff is aware, they wear appropriate protective agents, and then we check the patient for any other causes of illness, flu, rhinovirus, etc. We run a 22 virus panel, and if all of those are negative and their symptoms and travel history are suggestive of coronavirus exposure, then we do send a sample to the state, which will send New York State Department of Health, which then sends a sample to the CDC, that sample to the CDC. The CDC is currently running the test for most states. There are a handful of states that do have their own testing ability, but for the vast majority of states, New York included, the CDC is running those tests. Then what are the other areas of preparation? So within the hospital itself, we have rooms set up that are designed to be isolation rooms so that other patients are not exposed to the coronavirus, other staff members are not exposed unnecessarily to the coronavirus. And so if we do get a patient or an influx of patients, we are prepared to handle that. Having said that, 80,000 patients, what we're seeing in China, is a significant number of exposed patients that require a lot of medical care. And what's happening over there, is that they're running out of treatment options. They're running out of fluids. They're running out of oxygen, etc. I do think the U.S. is better prepared in this instance for this. We stockpile. Just this past weekend, as it happened, we had a ChemPack review. We stockpile chemical agents for, this is specifically for a different type of insult, but the state came in and reviewed that. So the U.S. has been stockpiling for a number of years for a number of events. I do believe we're ready. One final comment. How do people protect themselves at home? It's same common sense for the flu as it is for the coronavirus or COVID-19. Proper cough and sneeze etiquette. So you cover with your elbow, not with your hand. And I prefer to give fist bump to people. That's just my way of doing things. That's how I roll. But if you're shaking hands with people, then wash your hands frequently. And you should wash your hands frequently anyway. And especially before touching your eyes or your nose, your mouth, wash your hands. Before you eat, wash your hands. So some simple common sense techniques can help protect us. Clearly, if you see you're in a room with somebody who's sick, if you can get out of that room, get out of that room. There's no reason to expose yourself unnecessarily, whatever that illness may be. And it could be the common cold. These are ways to protect yourself. The incidence of coronavirus in the U.S. is not at a level where we need to be worried that somebody sitting next to us on the bus coughing has coronavirus. We're not there. So I don't want to create a panic or a scare. I think this technique will save you from getting the flu, getting a cold, or getting any other related infectious illness.
I know we get the question a lot, and we're going to open up the questions, but a lot of people ask, should I wear a mask?
So wearing a mask, right? Culturally, we see that in Asia, wearing a mask is commonplace. And if you're sick or if because of the air quality over there, people wear masks, it's routine. I would say if you're not sick in the U.S., wearing a mask routinely is not going to offer you that much protection. If you're going on an airplane and you're sick and you want to wear a mask as a courtesy to the other passengers, that might be a good idea. But short of mass transportation kind of a situation, I would not suggest wearing a mask at this point.
I would just add to that, the purpose of the mask isn't for the person wearing it to protect themselves. The only people that should be wearing a mask out in the public at this point in time are people that themselves are sick, as Dr. Sharma said, to prevent them from bringing into the atmosphere around them large particles that will potentially infect somebody else. But it's really not to protect you. If you're healthy and you're wearing a surgical mask wherever you may be, it probably is just a waste of time and effort. If you're sick, that's a reasonable thing. The first thing we do when somebody comes into the emergency room who has potentially infectious disease, like the novel coronavirus, is put a mask on them. That will decrease the amount of virus that they're putting out into the air. The only people that should be wearing a mask to protect themselves are healthcare workers that go into a patient's room with a potentially aerosolized virus or other infection. And that mask is not a surgical mask that they should be wearing sometimes. Sometimes it is, but other times it's a special, what we call an N95 particulate respirator mask, for which you need to be fit tested and trained on how to wear that mask properly. So the average person on the street, especially if they're feeling okay, doesn't need to wear a mask, buy a mask. People don't need to stockpile masks. There are shortages of masks. The masks belong really in appropriate use, mostly for very sick patients and for the healthcare workers who are taking care of them, but not in the streets or in public areas.
Good. Any questions, Caroline?
Yeah, you had spoken about a stockpiling of supplies. Were you talking about the U.S. or the hospital actually has supplies stockpiled as well?
So both. The U.S. has plans that hospitals are stockpiling, and we've been stockpiling long before coronavirus. So the ChemPack I refer to is a stockpile that we do for the federal government. We're a resource site, so that means that if, let's say, this was specifically for a neurotoxin, the ChemPack, there was an attack, we would be a local agency to distribute that to our other sister hospitals. So similarly, we stockpile other agents, including masks and other resources such as fluids, et cetera. So we've been stockpiling for a long time.
And you said you have isolation facilities that, like for a patient. Can you give us an idea of just how many you could isolate?
So any room can turn into an isolation room,
Oh.
and we have 455 beds within the hospital. So that
any room could become an isolation.
for this purpose, for coronavirus.
The different levels of isolation rooms. You have the ideal, the optimal is what's called a double door negative pressure room. and that's really for the highest risk patients. And then you really just want sometimes to have the patient be alone. And that could be a room in your house. We are self-quarantining. We're recommending that patients who don't really have any reason to be in the hospital but have a potential exposure while they're being ruled in or ruled out for whatever illness they have, go to their bedroom and stay alone in their bedroom, and everybody else shouldn't be going into that room on a regular basis. That's an isolation room also. So there are different levels of isolation.
And is anybody in one of these isolation rooms now?
We have patients in isolation rooms every single day at the hospital.
Anyone suspected coronavirus?
At the present time, no.
Thank you.
All right, any other questions about the poll findings, or coronavirus, or the flu?
Well, is the word getting out there, or are people taking the proper level of concern?
So the poll showed that 90% of people were aware of the coronavirus, and that was good, because that education is important for the U.S. public to be aware. Awareness should not lead to panic. That's the most important thing. Again, the current rate of infection in the U.S. is not at a level that should create people to be worried. People should be aware. And as I said earlier, this past week was President's Week. A lot of people traveled. They went on airplanes. I don't think it affected domestic travel. But if you're going to an area that's endemic has a high level of coronavirus presence, that I would have considerations about changing those plans, because there your risk is unknown then.
And the CDC has put out travel advisories to certain countries. And most of it's just common sense. If you're going to an area where there's potentially a significant level of COVID-19 around, unless you absolutely have to go to that area, it would make sense not to go to that area. But this would be true of any infectious agent. Unless you have to be there, you're a physician, you're taking care of patients, you have pressing business needs that cannot be put aside, so then one needs to use the best potential protective personal equipment in those situations and good public health regimens.
Thank you so much.
Thank you.
Very good, thank you.